Hi, my name's Jolene Beer, and I'm doing female catheter insertion for Nursing 2 skills. So first thing I would do, I would come in, I would check the physician's orders, make sure that I had the right catheter, that we were inserting it on the right patient, and just make sure I had all my supplies that I needed. I would talk to the patient, make sure she knows what we are doing with the Foley catheter, and I would make sure the patient is laying on their back in lithotomy position. I would close the curtain to make sure that we have privacy, and if they have a roommate, that they do not see what's going on. I would check the patient's armband and prepare my information and wash my hands. The armband I want to make sure goes in contrast to who I'm looking for. Okay, so first thing, I'm going to come in, curtains closed. I'm going to take my catheter set, I'm going to put it on the bed in between the patient's legs. At this point, my hands are clean. I don't have any gloves on or anything like that. That's right, yeah, okay. I'm going to open this sterile procedure-wise, staying within my borders. Okay, you got that. Sterile field. I'm going to take my gloves. I'm going to put them over here. I don't need them. This is the sheath that goes under them, and I want to make sure I keep it and shake it open. Shiny side is going to be going down. I want to make it sure it's sterile, and I want to fold it. Glue down right. I'm going to put it down like this. And it's not going to be perfect, but I can't do anything about it because I don't have sterile gloves on yet. I don't need this, so I'm just going to toss it. Okay, now I'm going to put on my sterile gloves so that way I can touch anything inside the sterile field. Okay, I'll put this one on first. Make sure my glove is good. Okay, now I can touch with my sterile glove. Okay. I'm going to keep my thumb in so I don't contaminate my gloves, and I don't want to touch my skin with my other glove. Okay, and I missed a finger, so since this is sterile, I can touch and fix and put it on. Now my gloves are sterile. I need to keep them above my waist, not to contaminate anything. Now that my hands are sterile, I can take this and I can slide it underneath my patient's legs. I don't want to cross the sterile field. Okay, and now I want to take apart my catheter kit with order of use. Put the catheter here. Other stuff there. Okay, I don't need this. Just going to toss it. Okay, and then I'm going to check the balloon inside the Foley catheter to make sure it is working. So we're going to take it out. Open this up. I'm going to check for the balloon to infiltrate. It works. So I'm going to let the water back out and leave it just like this. Okay. These are the cotton swab, not the cotton swabs, the iodine sticks. So we can open these. I can put them in my tray. Okay, and this is the lube that I'm going to use for the catheter for easy insertion. So now I'm going to go ahead and take off the protective covering, and I want to make sure I have control of my catheter so I don't contaminate it. Okay, and I just want to get it lubed up and ready to go. Stop there. Okay, I'm going to find with my non-dominant hand, I'm going to pull apart the labia and I'm going to find the meatus like this, and I see it. It is good to go. Alright, so now I'm going to clean her up, and mine are frozen, but that's okay. And I'm going to go, since I'm in a sterile field, I'm okay to cross like this in the beginning. I'm going to go down one swipe, not to cross the sterile field, and throw away. Okay, I'm going to go down the other side and clean, but I'm not going to go across my sterile field when I'm coming back. Okay, then I'm going to go down the middle, swipe and clean, throw away on the side. Okay, with my dominant hand, I'm ready to insert the catheter. Just want to make sure I have enough lube to make sure it's not painful. Okay, I'm going to go ahead and find the meatus again, and I'm going to insert the catheter 2 to 3 inches until I see urine flow. I see urine flow, so I'm going to pinch it with my non-dominant hand. Come over here. Insert the balloon. And I'm going to watch for facial expressions of grimacing or anything like that to make sure it's not hurting them. Okay, then I'm going to take it and I'm going to take it off. That way it doesn't go back through the syringe, and I'm going to go around, and then I'm going to give it a little tug to make sure it's not going to come out, but nothing that will hurt them. Okay, and I'm going to put it there, and then I'm going to take this out, not to touch the bag because I have my gloves on, and I'm going to get rid of all my trash. We're done with this. Okay, now I'm done with my sterile gloves. I'm going to take those off. I'm going to wash my hands, antiseptic, whatever I have. Put on clean gloves. Okay, now I can get my catheter ready. We have urine flow. We're good. I'm going to tape this to the patient's leg right here. And I'm going to do it at the Y, so this can be a movable part. I'm going to take the bag, I'm going to open it up, I'm going to put it down for gravity so urine will come out of the catheter, attach it to a non-movable spot right here, and it's good. Alright, and then I'm going to clean the patient up, make sure I get all the iodine off of her so there's no irritation or anything like that. Make sure she's comfortable, make sure she's okay, and then I'll put the bed back down, raise any rails that I have, and we're good.